Good afternoon, all. My name is Devin Schultes. I'm the Manager of Program Development and Delivery here at the Cancer Support Community. Welcome to our first ever Community Health Worker Peer Support Forum. The CHW Peer Support Forum live event series is brought to you through the Cancer Support Community's Community Health Worker Oncology Focused Training Program. The program is focused on providing education and support to community health workers who work with people affected by or living with cancer. In our series of CHW peer support forums, expert speakers will cover important topics related to oncology patient navigation as it relates to the important work that CHWs do every day. The expert speaker presentations will be followed by an interactive Q&A session and peer discussion. Along with the CHW Peer Support Forum event series, the Cancer Support Community is also developing CHW Quick Guides, which are quick access digital and printed tools that community health workers can use in the field for oncology-related patient navigation. We are currently developing the first 2 quick guides in the series and look forward to publishing them in early 2025. Again, welcome to CSC's inaugural CHW Peer Support Forum, and we thank you for being here with us today. If you would like to ask a question during the presentation, please do so using the Q&A feature in Zoom. Questions will be addressed at the end of the presentation today. And to turn on closed captions, please click on the CC button in the Zoom toolbar. For those of you who are joining the Cancer Support Community and an event of ours for the very first time, I'd like to tell you a little bit about the Cancer Support Community. For more than 40 years, we at CSC have been relentless allies for anyone impacted by cancer. We help individuals manage the realities of this disruptive disease and get back to their version of normal. Whether you're accessing our free services in person at one of our nearly 200 locations, online, or via our toll-free helpline, you're getting a team of licensed professionals providing patient navigation, financial counseling, genetic counseling, pediatric support, and so much more. Before we officially get started, I'd like to take a moment to recognize our speakers. We are so grateful for the support of the Biller Family Foundation and Bristol Myers Squibb in bringing you this event today. Now that we've got our housekeeping items out of the way, let me officially welcome you all to the Cancer Support Community's inaugural CHW Peer Support Forum. Today's topic is empowering communities impacted by cancer to share their voice. I'm extremely grateful to have with us today our guest speaker, Ms. Candace Straw, an expert CHW who will help us understand how community health workers can play a vital role in empowering communities impacted by cancer to share their voice and why it's so very important to do so. Candace Straw, BA, CHW, holds the Senior Community Health Worker Advocacy and Research position at the HAP Foundation and is responsible for serving the South Side region of Chicago. In her role, she delivers free public education on serious illness, encompassing themes of grief, caregiving, and advanced care planning, and disparate access. Her educational background includes a Bachelor of Arts degree in psychology from Oakwood University, and she currently holds a position on the Special Commission for Gynecological Cancers for the state of Illinois. As a CHW innovator, Candace recently led a project with NORC at the University of Chicago, enhancing understanding of hospice and palliative care among Black individuals residing in Chicago. In 2022, she received the American Public Health Association CHW Section Leader Award for integrating CHW roles into research. Candace was also recently awarded the 2024 Emerging Leader Award through the Health and Medicine Policy Research Group for her work in public health and social justice. Candace, welcome. Thank you so much for joining us today and sharing your immense wisdom and expertise with our attendees. Without further ado, I'd love to hand off the mic to Candace.
Good afternoon. Good afternoon to each of you, and welcome to the first in a of webinars for community health workers for the cancer support communities, where we empower community members to use their voice and to speak up for their community. I am so glad that you took some time out to come today to enjoy this webinar. And I am excited for us to grow together and to learn and for you to take the information back to your prospective employers. So let's get started. So I wanted to talk a little bit about some of the policy work that I do. Role as a community health worker. I am on the National Association for Community Health Workers Policy Committee. And the purpose of this committee is to advocate for the needs of community health workers. We in Illinois, I do meet with the offices of Senator Dick Durbin, Tammy Duckworth, and Congressional Representative Jonathan Jackson as a way to get co-sponsors for bills that do support community health workers. And as advocacy is a key part of what community health workers do. So this is a picture from when I and some other colleagues from across our 50 United States gathered in DC. We did request co-sponsors for the National Community Health Worker Awareness Week that I'm sure many of you knew about, and also billing for CHWs, but also an avenue to where community health workers will be sustainable and a very valid form of employment for our employers. Okay, there we go. I wanted to make sure that people knew about, I wanted to come before you today to talk about some podcasts that I've recently been on. I have 4 podcasts, including We Have Pod, Bump in the Road podcast. This podcast, I go deep into my role that I've done as a advocate for cancer, but also caregiving experiences around when I cared for my mother when she was passing from ovarian cancer. These go really, really deep into detail and give you just like a further look as to, communities, but also how as a community health worker can get more integrated in cancer care and for your caregivers. So I am a fan of quotes. Anybody that knows me knows that I absolutely, absolutely love quotes. This is a quote by Zora Neale Hurston. And I thought about this because we are talking really about empowering community members, and we see a diverse group of community members in our day-to-day. And also for community health workers, for those of you that are in high settings, the quote that if you are silent about your pain, they'll kill you and they say that you enjoyed it. Zora Neale Hurston is one of my favorite iconic Black women figures. In our work, we see some of the most vulnerable populations, individuals from marginalized communities seeking care or resources. This displays a very powerful message about speaking up against oppression, injustice, and suffering. Often the very systems that we rely on and those in power take advantage of silence to justify harm. This quote calls for self-advocacy and resistance in the face of suffering. So we're going to talk about 4 objectives today as we spend time together. First of all, we're going to talk about a little bit about the work of a community health worker, the importance of community voices, identifying barriers to care, and strategies for community empowerment. So, what do community health workers do? First, I want to point out the community workers are not low-paid workers. Sometimes we can get viewed as social workers, but we are not social workers. I pulled a definition from WebMD. Community health workers are public health workers. Our goal is to connect communities with healthcare systems and state health departments. Another way to describe CHWs are, we are community advocates and often agents of social change. And because of this, it is important that community health workers understand and respond to the societal and cultural norms of the communities they serve, and almost all CH community. You can find community health workers in churches, community-based organizations, clinics, homeless shelter. More recently, I found community health workers in smaller health advocacy places. I found community health workers in smaller clinics. So community health workers is a workforce that is equitable, is sustainable. Well, we're working on sustainability, but it is growing. And you can find community health workers in each one of these spaces and to provide community resources for the populations that they see. The importance of community voice. So let's talk about facilitating change in the cancer space. My mother died of ovarian cancer in June of 2014. The very person that gave the eulogy at her funeral died of gallbladder and pancreatic cancer a year later. And then another very good friend of the family died of pancreatic cancer a year after that. As a caregiver for my mother and in speaking to other people, these were some points that I really felt were very, very poignant for me, that I felt the community health workers needed to learn about. First of all, in the cancer space, and this is for care overall, but specifically because we're talking about empowering communities and cancer patients, I want us to take some time to listen to our patients. What are their concerns? This goes beyond just asking routine questions. Acknowledge concerns, emotions, and experiences. Tailored needs and support for care. Tailored needs refers to understanding that every patient journey is different. Community health workers can assist by encouraging care teams to tailor support for one specific condition, treatment, and personal circumstances. This will improve patient satisfaction overall. Improved patient-provider communication and culturally competent care can go together, meaning community health workers can provide language support, educational resources, simplified medical information for their community members, encourage regular check-ins, and empower patients to ask questions about their diagnosis and treatment goals. Culturally competent care, I cannot emphasize this enough, is key in cancer and in healthcare across the board. It is vitally important that communities see providers that look like them. Also, that they are comfortable expressing those needs to the people that are around them. And often community health workers, we can be patient navigators, we can be health educators. Either way, it's important for patients to know that they are really being heard. And as community health workers, we can aid in that support. Here are some to cancer care. Financial barriers, cost of treatment, insurance barriers, limited or inaccurate insurance. Again, when you work in marginalized community, you see these a lot. Not really understanding their health benefits. It's one thing to tell a patient that, hey, this is what's covered, but it's another thing for you to empower your patient to really look at their medical health, at their medical benefits, and see for themselves what is covered, what's not covered, and also encourage them to ask questions. Patients in rural don't have options for care, meaning they may not have transportation, they may not be able to get around the way that they want to, or may not even know how to even start treatment. Again, community health workers can come in and provide that support. Psychological barriers. Okay, not only am I dealing with the diagnosis, I also have to deal with the fact that, okay, am I able to keep my job? Can I keep my health benefits? That's fear, that's anxiety. That's denial, depression, stigma. All of this goes into barriers to cancer care. Inequities and disparities, racial and ethnic. Am I really even being heard and seen as a patient of color? Do you even care about what I'm going through? Are you sensitive to what I'm dealing with? Am I able to have all my questions answered in a timely manner? And another thing is that availability of specialists in cancer care. This is another barrier to cancer care. And addressing this requires a multifaceted approach. This includes improving access, enhancing patient education, providing financial assistance, there are resources out there, and ensuring culturally competent and coordinated care among team members. So here are some strategies for community empowerment in cancer care. I would like to I decided to do a Zoom poll, and I would like to ask a couple of questions. So the first question that please answer, do you know what clinical trials are? And that's yes or no. And then do you inform your patient community members to ask their doctor about clinical trials during their cancer treatment? Okay. So a couple yeses, nos. Okay. So for the first question, 94% said yes. For the second question, 6% said no. Okay. And number two, do you inform your patients, community members to ask their doctor about clinical trials during their cancer treatment? 53% said yes, 47% said no. Okay. So we can stop sharing the poll. So, what are clinical trials, first of all, before we go through all of these? Clinical trials are research studies that are conducted to evaluate the safety, efficiency, and effectiveness of medical interventions, drugs, or treatments that can improve patient care. As a community health worker, you can educate your patients to discuss clinical trials and options with their doctor and encourage participation. Also, community health workers can increase awareness and education, referrals, and CHWs can advocate for diverse representation, ensuring that they reflect the needs of various groups. Um, you can advocate for community needs as well in cancer care. You can make very distinct and clear partnerships with other community-based organizations that provide cancer needs for individuals. Emotional and social support, sometimes you'll have a patient that will request you stay in a room with them and that you hear them out. That's good, and I think that that's something that's needed. But as a community health worker, I think that it not only do you advocate for your patient, I want you to also consider encouraging your patient to advocate for themselves. Care and with whatever you do, advocating for yourself is key and it's important. Encourage your patients that if they're not being heard to, insist that they either get a second opinion, see another provider, and that those are options that are provided to them. And as a community health worker, we want to encourage cancer across the board for the whole person. And increasing their education means that you can give pamphlets, you can give brochures, you can, depending on what type of cancer that they're currently facing, and encourage them, to read up if they have questions, write their questions down. If they need additional support, allow them to feel comfortable and know that they can do that. So I want to talk about a real life scenario that I was faced with. Not only did my mother pass from cancer, but I recently had a very, very good friend who was diagnosed with triple negative breast cancer about right at the height of. And I remember her and telling me about her diagnosis. But I also remember her being very scared. She lived alone. She really didn't know, what to do, but she had this lump on her breast. And I encouraged her, I said, well, you need to go get that looked at. You really need to be, proactive. And so when she did and she found out her diagnosis, I remember her just being very, very tough, but being very resistant to care. Often patients that are resistant to care. It's not that they don't need the care, but often they can be afraid. They may not know how to ask for it. So one of the things that I did was encourage her to look up to, I provided her some breast cancer um, pamphlets. These are things that I had myself. I also encouraged her to write down all of her questions. I encouraged her to speak to her doctor. I encouraged her to really, really, think about, anything that, she needed, and to also let her know that this is something that she doesn't have to go through alone. How to encourage someone dealing with a cancer diagnosis. These are free community resources. I don't know if anyone's ever heard of Ignite Hope Candles and Kits to Heart. Um, Sonia is a 3-time cancer survivor for Hodgkin's lymphoma, and they send out free care packages to people fighting cancer. Ignite Hope Candles was a blog that I was featured across where I talked about my community experiences with cancer, with my mother's diagnosis, but this is another resource for people who are fighting cancer. It is to provide encouragement, is to provide support, and you as a community health worker can go on their website and you can nominate people for care packages. And this is how I also helped one of my friends who was going through cancer. She would get packages in the mail, but she didn't know who they were from until she brought it up one day and she said, I got candles, I got these socks, this was amazing. She said, and I don't even know who's doing it. And I said, I did it. You know, you can provide support like that. You don't even have to tell people that you're doing that. You know, it's something that encourages you as you're going through cancer. The Foundation for Women's Cancer here in Chicago and the Black Cancer Collaborative, Kimberly Richardson, a very good colleague of mine, founded the Black Cancer Collaborative, which is a nonprofit that dedicates itself to sharing the lived experiences of Black cancer patients with medical and science communities. I played a role along with myself and 2 other community health workers. We facilitated a 2-day training for community health workers here in Chicago on the West Side, around the city, on dealing with cancer patients along with 2 colleagues. For this particular cohort, we dealt with gynecological cancers. CHWs learned from doctors. We had real life experiences. There were survival stories from women who battled gynecological cancers. We also had breakout sessions, and in the breakout sessions, we allow community health workers to, you know, talk about some of the things that they see as they're working, you know, bedside with patients. We also encourage them, you know, in the same way that I did in the previous slides where I said that to encourage them to speak up about their care, make sure that they ask their doctor about clinical trials. One of the things that's wrong with clinical trials now is that not enough people of color participate, so they don't have enough data to know what works with certain demographics. So that is another ways you can encourage patients. Always encourage them, always say that your needs are important. You are as important as a person is important, but also, you know, if there's a social worker on your team in the hospital, make sure you communicate with them as to what's going on as well. So the Illinois Special Commission on Gynecological Cancers, I received an appointment early last year about this for this. I'm very, very pleased to sit on. I think that, you know, one of the things that the commission specifically focuses on gynecological cancers is to research gynecological cancers in Illinois and identifies the most effective treatment. We are broken up into subcommittees: early detection and risk reduction. We meet monthly and we go over treatment and prevention. And the purpose of this is to identify needs, social determinants of health, fighting health disparities, and making sure, and now we're working to develop some toolkits. We're doing some other different things for, you know, women's gynecological health. We had a listening session on June 22nd where patients spoke about their lived experience with gynecological cancer. It's important because on our only in my community health worker, but one of my other colleagues is as well, and she is taking the information back to her community health workers in the hospital. And this is stuff that is done at a state level, because as community health workers, we're really good grassroots level, but we need policy to change. We need procedures to change. And in order to do that, that's why this vital work is so important. And finally, I wanted to make sure that, you know, we understood that we heal in community. I want everyone to know that there's somebody else who has been where you are. In cancer care, it can feel alone, it can feel isolating. And if you're a person that's someone with cancer, you are really, really going through a different set of barriers. And I wanted everyone to know that there's power in community. There's power in togetherness, and that empowering your community members to use their voices, empowering them to speak up for whatever that they may need is not just something, and that they don't need to be afraid to do that. They, you know, speaking up is something that can be intimidating, but when it comes to your health, you can't put a good price on your health. So know that I've really enjoyed speaking with you all this evening. I hope that you all have learned how to empower your communities and how to take back this information to your patients. And thank you.
Awesome. Thank you, Candace. We can go ahead and stop sharing the slides for now. We really appreciate you sharing your insights with us through that really wonderful and insightful presentation. And now it's time for our question and answer portion of our time today. So attendees, if you have not already done so, please do post any questions that you have for Candace using the Q&A tool at the bottom of your screen. And it looks like we do have a few to start with. Candace and I will get through as many Q&As as possible during our time today. Just know we'll try to get to as many as we can. The first one, it looks like that I have here for you, Candace. Let's see. All right, so we had an attendee ask, or I should say submit, I work in a rural area and it's only me and one other community health worker here. Where do you think that I should get support in being able to help my patients that have cancer?
Oh, great question. Okay, so partner with other community organization and cancer centers in your area to increase your access to care, or you can see if there are any support groups or online options for care virtually. I know that can be really, really challenging when you live in a remote area and there's nobody, around. See what other community organizations you can partner with. That's one way. And if there are any other support groups or if there's something that they can do virtually, you can take that information back to your patients.
Awesome. Thank you. All right. Our next question for you, Candace, what do you recommend for when the patient that you're helping is receptive to the intervention, but then their family doesn't want the help or doesn't agree with it?
Oh, that's another good one. So I said your intentions as a community health worker. Sometimes people are receptive to what they don't know and what they don't understand. State your intentions and give resources as needed, but let the patient decide how they want you to be involved. Sometimes people, get really, really defensive. It's a hard time, but if you can only go as far as the patient allows you anyway. It's different if it's a child affected by cancer, then that's the parent deciding how far you can go. But if it's an adult that's legally they can make a decision, then you can only go as far as they allow. So state your intentions and give resources, but give them room and then decide how they want you involved.
Awesome. That's really helpful. And that is a really great question. Let's see. One along kind of the same lines here. Someone said, how do you put aside your personal views or opinions whenever your patients are making decisions about their healthcare? So less about the family in this question, more about that patient.
So you're as a CHW, you're faced with a lot of different scenarios in this field. So remember that your patient is a person, first of all, and able to make their own choices despite what your opinion may be. Give your facts to your patient. If you're on an IDT team, make sure you document that in their chart. And also if there's a social worker on team, you can speak to them about any recommendations that they may have, but give them room to make a decision. Sometimes you're always going to have some patients that ask you, what would you do? How would you do this? That's normal. And it's important to maintain healthy boundaries. Give an honest opinion, but at the same time, allow them room to make a choice, no matter what that choice is.
Thanks, Candace. That's awesome. Let's see. Our next one here is from an attendee named Izzy. Izzy says, do you have any self-care suggestions for CHWs assisting people that are impacted by cancer? I think that goes along really well with what you were just touching on with boundaries.
So I think that, well, first of all, community health workers, we do a lot and we see a lot, okay, and between our community members. I specifically work a lot in end of life. And so, dealing with certain really, really, this is a hard topic, hard things to deal with. As a community health worker, like I said, you need to maintain boundaries, but also take some time to decompress. Take some time to sit down, to, on your lunch break, put work to the side. Take an hour for yourself, however long your break is, just for you to do nothing or do something fun that you like. Um, we're dealing with a lot of heavy material. Okay, this is not see people, you hear their stories, you know.
All right. Someone asked, what are some of the biggest barriers that you come across as a CHW supporting this patient population? So folks who are impacted by cancer. Any specific recommendations in navigating costs, insurance, any home care needs?
So what I've done is, whenever so my job, I provide free community education. And so whenever I have talked about cancer in the community, I have heard all kinds of scenarios. I've heard, I don't know how to do this, I don't know how to do that. One of the things that I always encourage them is to, especially if it's an older patient with a caregiver, to write down what their needs are and then address them one by one. To The other part of that question was what, Devon? The other part of, can you repeat the other side?
Yeah, for sure. Sorry, I'm just finding it again.
As you said,
Looks like, so the second part was any recommendations in navigating costs, insurance, and home care needs associated with that cancer diagnosis.
if they're on an IDT team, encourage them to talk to their social worker for their needs. If provide free for them to like if you need a home healthcare aid. But again, sometimes their home healthcare aids are covered by insurance, or you get a certain amount of hours that a home health aid person will come in and they will help you. As far as financial, there are some organizations that do provide assistance for cancer. That really is tailored per whatever the diagnosis is, whatever it is. So those will have to be individually. Um, and then encourage them to look at some other community resources. Again, you can help them with insecurities. You can provide them. I did that. I provided a patient with food insecurities that was fighting cancer. I a local food pantry, and I sent them there. And then I also encouraged that they, when the Greater Food Depository here in Illinois, when they go to the different shelters, or when they have the different pantries that they stock, I encourage them to go there. I've encouraged religious care. I've encouraged all kinds of things. So yes.
I love that. Yeah, really just leveraging what's out there in the community for folks to be able to take advantage of and yeah, get that help that they need.
Absolutely.
Right. Let's see. And I will just kind of throw in there too, the cancer support community does have a ton of resources specifically around navigating the cost, insurance, and other things related to a cancer diagnosis, both for patients, but also for caregivers, people in that care team, also for healthcare professionals. So tons of resources. Looks like it was just dropped in the chat too for specifically the cost of cancer and our cancer insurance checklist. So definitely recommend checking out those resources as well for potential patients that you're working with.
Yeah,
Okay.
and as well as support community, there's also the Wellness House here in Illinois, and there are also it's tailored to your respective states, whatever free resources are out there. But for caregivers, there's virtual support groups. There's also in-person support groups that Gilda's Club has. I was on the associate board here in Illinois for about 4 years on Gilda's Club. So these are free. Recommend also if you have children that need something to do during the summer, they provide free, summer camps for kids, all kinds of different things. There's a learning library. So, you those
All right. Looks like we just had a question come in that says, is the cancer support community a national community or is it just Illinois? Great question. So, cancer support community is actually a global community. So, we have nearly 200 locations all across the globe, mostly here in the US and in Canada. So, you can visit our website and click find a location to find a location that's near you. But Candace can kind of talk a little bit about her, if you want to, Candace, your experience with Gilda's Club Chicago near you, or any other experience with CSC on more of a local level that you've had.
Yeah, so when my mother passed from cancer, I ended up looking up cancer resources that I didn't even know existed. She received care at Cancer Treatment Centers of America here in Zion, Illinois, and that's a amazing facility. So I looked at some of their boards and I saw that there was a Gilda's Club and it was a Chicago location. And again, I didn't know this existed. So I took some time to go downtown to Chicago and I did a tour facility. And I wanted to know more about what they offered. But when I found out that it was a free resource, that families affected by cancer could come in, and there were yoga classes tailored for people with cancer treatment. There were music thanatology classes. That there was a whole resource learning library. That they even one of the really famous baseball players here. He no longer plays for us. He no longer plays for the Cubs, but Anthony Rizzo provided tickets to the Cubs games for kids during the summer because he himself was a childhood cancer. So, you know, there were all kinds of different things. I really, didn't anything that's free and that's worth it is something that you should encourage your patients to advantage of. Also, Wellness House was the same way. That's suburban Illinois, how they had free educational events, free webinar events. This was online and in person, how they had support groups online and in person. And this was just really, it was something that I didn't know, existed, and something that you can share with your patient population.
Awesome. Thanks, Candace, for sharing. All right, we have a question. How can you explain the role of a community health worker to someone who doesn't really understand the role that I play in my patient's cancer care? I think that's a great question.
That is a good question. So first thing is that if you work on an IDT team, you are a key part of that team. Sometimes IDT teams, sometimes it could be challenging to be on a team with other team members because sometimes they don't view the community as somebody that should, I guess, be there or even knows what they're talking about. That's not true. Community health workers have an active role on IDT teams, and that is to provide patient support for the demographic that they see. Also, I would encourage you to speak to, I'm not sure who manages you or who you report to. It is also their responsibility to make sure that you are fully integrated on that IDT team, to make sure that you're a part of that team, that you are here, that that you also need to be included in patient huddles, that you need to be updating notes as well, even if you don't get to do that, but you need to take accurate notes and make sure that they're getting back to the team. Also, and just making sure that your voice is also heard because you have one-on-one contact along with patients as well. It's not just doctors, it's not just nurses, it's patient navigators, it's community health navigators. Those have one-on-one touches as well. And if you do have a patient, encourage them to request a community health worker, encourage them to request a patient navigator, because a lot of times they don't know they can even do that. I mean, to be frank. But sometimes, and if there are resources that you have, make sure your patient sees them. It really the person that supervises you to make sure that they are pushing.
Awesome. Sorry about that. I think things froze a little bit on my end there towards the end. Oh, might have happened there for a couple of other folks. But yeah, super helpful. And I think that's a great way of really just making sure that everyone in the team understands your role. I guess I'd
Right.
love to ask a follow-up question on that one. When it comes to interacting with patients who maybe haven't heard of community health workers before, but now the community health worker is such an important role in their cancer care coordination. How do you explain it to them, or maybe someone who's a new patient or a family member who's working with a community health worker for the first time, and you can kind of find a way to share with them what you're able to provide?
I usually, well, in those cases, it's just gradual. That's called building relationships. That goes back to building relationships. The more that you're seeing that your patients see you, the more they'll become familiar with you. You can do a one-on-one touch. You can do something, hey, you can introduce yourself, say who you are, say what you are providing, and then give them room to either request you again or just check back in on them and frequently, asking them how their treatment options are going, how they're feeling today, and you don't want to be too intrusive, because until they truly understand, number one, can they trust you? Are you giving viable information? Number three, do you know what you're talking about? Those are three things that patients want to know. Are you just throwing something at me? Or are you really hearing me? And that can only be done over time. And it's step by step.
That's super helpful to hear. And there's another question in the chat here that's specifically asking about how to build better relationships with patients. So I think you've touched on so many great points, like that frequent contact, really making sure that they know your name and face. Also making sure that they understand that you're there to listen and really hear them, but also to build that credibility.
Right.
Is there anything else that you would add that could really help build those quality relationships with your patients that you're working with?
Make sure that the information that you're sharing is accurate and up to date. Sometimes, um, when and this is something that I've seen happen a lot, where you can give some resources, but they're not valid. The number's disconnected. You don't know. Make sure that whatever you're giving them, you sit down and you thoroughly explain it. And you say, hey, you can call this number. You can ask for this person. You can do that. That creates a common rapport, and it also creates respect amongst yourself and them. But it also means that you're trustworthy. So, and really, really listen to what they're telling you, and only ask for opinions if they ask you for what you think. You really just want to be a listening ear at first. You don't want to impose how you feel on anybody or anything like that. You just want to listen. And I think that, that's a really, really key way for building relationships. Make sure the information is viable, make sure you're doing active listening, and also be empathetic with your patients that are going a hard cancer diagnosis.
Thanks, Candace. Those are all amazing points. If folks have other questions, please go ahead and throw those into the chat. It looks like we're getting to a couple of our last few ones here. All right, we have a question in the chat. It says, it's about advocacy and awareness in rural areas and remote areas where people aren't more empowered and are less educated. How can it be possible to reach out in those areas and speak out to create awareness and prevention? Great question.
Prevention on the advocacy level?
Yeah, so being able to really reach out to those rural and remote areas where people aren't as educated and maybe feel less empowered to be able to speak out. So they're asking, how would you suggest kind of reaching out to folks in that area, and then in your role speaking out to create awareness on prevention?
I would do educational sessions if I could with those community members. I would also bring a list of resources to help. Um, I would also encourage your state leaders to really start getting more involved and integrated in rural areas. That's more a national, well, state level wide thing. But if you have like state representatives, that's another advocacy, a touch point. If you have, well, in the city they will call them aldermen, but if you have state reps, state senators, things like that, you can point out some of the rural needs in your community. And then you can give free informational sessions about cancer awareness, cancer diagnosis, and then how to help. You can also encourage them to go online and look up some other things. Rural areas are very, very challenging, but I think that if you go to your state leaders, that they will help assist with that. And if they don't, make them. Sometimes you have to be a little forceful to get the job done.
Yeah, and I think with your expertise in policy and advocacy, Candace, you're an amazing person to be able to speak on how important it is to really go in there and advocate for what not only community health workers as a population needs to be able to do their job well, but also what patients, caregivers, and other people impacted by
Yeah.
cancer need in terms of their need for
Yeah.
community health workers and their cancer care. So such important work that you're doing to advocate for both community health workers, but also for patients and caregivers who need community health workers too. It's really
Absolutely.
awesome. All right, folks, I'm not seeing any more questions in the chat. Candace, I'm wondering on your end, just after the enriching conversation that we've had today, is there anything coming to your mind that you'd really like to mention or be able to communicate to our attendees today?
Yeah, I really want to encourage you all, first of all, to make sure that you're first of all, wherever you are in the world, you're doing amazing work. Um, but don't let anybody diminish your role on
Folks, just be patient with us for 1 minute. It looks like a couple of other participants are experiencing a freeze. We'll just give it a second. Hope Candace's connection repairs. In the meantime, I just saw another question come in. Oh, looks like Candace is coming back in there. There you are, Candace. It looks like you
my,
froze for a
no,
second.
my internet just dropped.
You
So
were totally fine. The last thing we heard was diminishing your role. That was what you were talking about, right, when you froze.
So not don't let anyone diminish your role. Also make sure that they know that and I encourage each of you to see who your state and your local leaders are, your state and federal leaders, and to do touch points with their offices, let them know that you're a community worker. Not only do you need to be a sustainable workforce, but you also need to be an equitable workforce. And also, let them know your higher ups, wherever you're working, let them know what you're seeing on the ground level and let them know what the needs are. Often there's a disconnect between the two. Community health workers are a bridge between the two. So make sure that they know what's going on and really communicate candidly, but also come with some solutions. It's one thing to talk, but it's another thing to solve a problem. Make sure that you're encouraging your leaders to solve the problems that, whatever they may be.
Awesome. Thank you, Candace. Perfect. All right. I think that is it for today. Let me just do one last check. Oh, someone asked, Candace, are you doing another forum? So this is an event series. Hopefully we will have many more events that will be for community health workers. We're looking forward to it. And we hope to see Candace again, TBD. We will keep you all informed, that's for sure. I
Thank
don't
you.
see any other Q&As coming in for right now. So I'm going to go ahead and end our Q&A session. And we're going to go over just a few resources before we end the session today. Thank you. Yes, let's go ahead and share the screen again. Perfect. Before we end the time today, we would like to ask you all to complete a few short questions just to reflect on the event. So we will highlight a few educational and support services that CSC offers to support all people impacted by cancer, as well as healthcare professionals like community health workers. You should see that feedback poll come up. If you don't mind filling that out while I'm going over those resources, that would be amazing. Our first resource is Submit a Story. So an important part of CSC's mission is to collect and share stories from the people that we serve. Most stories are shared via our blog as well as some other outlets. So to find out more about sharing your story or to help an individual that you're working with to share their story, you can visit our website or the link in the chat. All of these resources will be put into the chat as I'm speaking, or you can find them on our website, cancersupportcommunity.org. CSC's My Lifeline is a way to connect with others and receive support from your network throughout the cancer experience. For more information or to help an individual start an account, you can visit our website or click the link in the chat. CSC's Cancer Experience Registry is a research study that collects information about different ways that a cancer diagnosis impacts patients and survivors. To learn more about how to help an individual participate, you can visit the website or again, that link in the chat. CSC's Grassroots Network, it helps you receive updated information about cancer-related issues that are discussed with lawmakers on Capitol Hill. You can learn more or sign up today. CSC also has nearly 200 locations across the globe, as we mentioned in our session today. So to find a local CSC or Gilda's Club Center near you, you can visit our website and click find a location in the chat. Just quickly, we want to say, Candace, thank you so much for joining us today. The information and the insights that you have shared are without a doubt invaluable to our attendees, and we are so happy to have you here today.
Thank you. Thank you.
Thank you. For folks, I just want to say a quick thank you again to our sponsors that made this really important event possible, the Biller Family Foundation and Bristol Myers Squibb. This webinar was also recorded and will be uploaded to CSC's event page on our website very soon. In addition to the feedback poll that you've just completed, we also ask that you take a moment or two to answer a few post-event questions that will be delivered to your email or pop up in your browser as soon as the event ends. And we ask that you provide any feedback that can really help us continue to deliver this valuable education and support to community health workers that are providing oncology navigation in their community. Just want to say thank you all so much for attending and have a wonderful evening, everyone. Bye, all.
Bye, everyone.